Thank you for attending our video poster on user engagement with mHealth interventions for adherence and self-management promotion. Very little is known about user engagement or interaction with these tools. Our systematic review aims to answer key questions about user engagement with these interventions. The final review included 292 unique studies. Most studies were non-randomized and involved people with diabetes or a mental health condition. Most interventions targeted medication adherence and were comprised of apps. Use and engagement were the most common terms to define user engagement. However, there were numerous examples of disparate terms. User login data and manual user data entry were the most common measurement approaches, and engagement measurements generally matched intervention components. Engagement level tended to be characterized at more than one level due to the use of multiple measurement and analytic techniques. Engagement tended to decrease over time, and only 31 studies allowed continued mHealth use after the study ended. Technology dosages and minimum engagement research benchmarks were rarely given. The association between engagement and adherence or self-management outcomes was generally positive, and user engagement was rarely a research endpoint. Based on our results, we recommend using standardized terminology such as use or engagement, the most commonly used terms when evaluating user engagement, to facilitate communication across the field. Select engagement measures that match the intervention and allow us to examine associations between engagement and adherence or self-management, as well as changes in engagement over time. Ideally, the engagement measurement will map onto technology dosages, which researchers should consider giving when appropriate, and allow researchers to set a priori research benchmarks for what they consider minimally acceptable user engagement levels to be. Treating user engagement as a research endpoint would likely support more rigorous measurement and evaluation of this important domain. And lastly, examining mHealth use beyond the formal study period would help to inform what real-world user engagement with these tools looks like. Thank you for listening.